So starting off with sports science and health. Sports science and health is a discipline that studies the science underpinning sports performance and the role of physical activity in the prevention of treatment of congenital and chronic diseases. So it's not just all about sports science and about helping elite athletes, but it's also about helping athletes with Special Olympics or just adapted physical activity and other populations where health is paramount and of higher priority. So as we see here, we have two elderly people. This is highly emphasized in the course. So let's take a look at what the course entails. So sports science and health. The course content begins with an introduction to the basic sciences and general aspects of sports science and health. Okay, these are general sciences. Year 2 takes a look at the scientific theory underpinning sports performance alongside laboratory and field-based practical sessions. So year 1 is mostly just getting your feet wet. The first semester is highly emphasizing the general sciences with an introduction to sports science, particularly in the second semester, but semester 1 is mostly general sciences. In year 2, we start to take a look deeper into sports science and understanding the theories that in year 3, we can take more of a practical aspect of exercise related to disease prevention and treatment and our work placement. So in year 3, in second semester, we actually have work placement, which I'll go into further detail in later slides. So year 4, we take a look at research and specialization in selected areas related to sports science and health. That's where we're going to do our end of the year project and dissertation. Okay, so if you take a look to our left, we can see the different themes. These go throughout the entire course. And here, in more detail, we see how much we focus on particular themes. So physiology throughout the entire course is paramount. It plays a large role in everything we do with sports science. So as you see through semester 1 up until semester 7, it's essentially throughout the entire course, other than in intra, unless that's something where you get a position in an area that focuses on physiology. We then have psychology, where we're introduced to the general science, and then we take a break from it, come back into it in semester 3 and 4, and again semester 5. So there is less of an emphasis on psychology than there would be physiology, but it's still very important for what we're doing, particularly understanding athletes and the general population, who will be the majority, as elite athletes and athletes in general only make up a very minute percentage of the population. So speaking about athletes, that's where we have athletic development and coaching skills. So we'll be taken through conditioning science in both semester 2, after we've done our general sciences in the beginning of first year, semester 3, so into second year, and semester 4. Then later on, we'll be taken in semester 5, so in third year, first semester, third year, with a high emphasis on coaching and inclusion studies. So this is going back to, again, the idea that not everything is going to be elite performance. There's a lot of roles that require someone who's able to teach people of different levels. So from the lowest level to the highest level, sports science takes a look at all of that. Then we see here, so in first year, first semester, there is chemistry and physics. So these aren't as used throughout the rest of the course. They're not. There's components of these, but yeah, we do have to understand the basic principles in first year, as it relates to physiology and biomechanics later on. So again, we get our first taste of biomechanics in semester 2, so understanding the movement of the body. So all these things, these all couple together to give a very broad overview and give us many skills in different departments of sports science. So it is quite a large area, which in turn leads to a lot of work opportunities later on, which again I'll speak about. So here we see year 2, where we have our conditioning science, anatomy and functional anatomy, integrated sport and exercise physiology, sport psychology, and exercise nutrition. Again, we do get to learn more about nutrition in second year and understanding when things should be ingested, the best times, why. So it's not just all about physiology and psychology. There is acknowledgement of nutrition to better help the performance of athletes. And then we go into semester 2, where we continue with our conditioning science. So this is the fun stuff. This is where we get to learn how to coach, how to what modalities work best for athletes and why. And it is interesting and fun, and you do get your hands dirty with this. And then we have other topics such as genetics and health, which at first glance might seem a little confusing to people. But again, this is actually where I'm doing my intra placement this year, is with genetics, as like, especially with elite performance, genetics are a large factor. But also when it comes to adaptive physical activity, why someone might be experiencing certain ailments, a lot of that can be explained through genetics and environmental factors, which we go through in this module. And continuing with, as I mentioned before, physical activity psychology, biomechanics, and research methods. So understanding how to actually come to the understanding of why a paper is valid or not, and how to do our research in a scientific manner. So before I skip along there, just another look here at the timetable. So if you see in semester 6, we actually have an intra placement. So an intra placement is, I'm going to move on to that now in a moment, is going to help bring this all together and give us a better idea of what we might want to get into after the course, as it is such a broad course and it does open so many opportunities. We get this opportunity, we get this chance to play around with some of the ideas that we've developed in our interests throughout the course. So that can be in coaching or in academic areas. So here we are speaking about intra. So intra is arranged through DCU, or you can arrange it yourself, as long as you get the go ahead from the coordinators. It integrates academic study with closely related jobs, provides students with an understanding of the professional world, helps students to stand out in the graduate employment market. So it could be in health service, national health, wellness organizations, primary schools, secondary schools, sports organizations, sports clubs, hospitals. There is opportunities in hospitals and in the medical field, and with professional sports teams. So as you see, sports science does open a lot of doors and windows and hatches and just areas in general, a lot of networking through sports science and health. And universities, of course, local councils. So what type of exams, assessments, projects take place in sports science and health? So it's all continuous assessment. So you're graded throughout the year. It's not just one test at the end of the year or 5 tests at the end of the year. There's written assignments. group projects, laboratory practical exams, so being able to get hands-on experience in the lab. There's also voluntary lab experience too. Field-based practical exams, so again, putting your experience in and knowledge into practice, research, written tests, and then with some modules, there are some end of term examinations. So, as I was speaking about earlier, here's some of the career options. So in sport, coaching and development, athletic development, sports science, support data analytics, health, so promotion and advice, clinical exercise specialists, recreation, some public and private sectors, education through physical education, physiotherapy, medicine, nutrition, dietetics, occupational therapy, business, and graduate studies, taught and research. So sports science gives a lot of opportunities, a lot of experience, and a lot of knowledge in a lot of different areas, and gives the potential to specialize in areas through postgraduate courses, in master programs, and your interplacement is in third year, in second semester, is one way to figure out what you might like to do and where you might like to go. And guys, just because I didn't mention in the beginning, I'll answer all questions if there are any at the end of this presentation. Okay, so we're going to speak a little bit on athletic therapy and training. Okay, so what is athletic therapy and training? It's a degree which qualifies graduates to professionally work with athletes and non-athletes to prevent, assess, treat, and rehabilitate sports and physical activity-related injuries. So this course is far more specific than sports science and health. This is very much geared towards anyone who has decided that they want to work with athletes in preventing and treating injuries. So again, as I mentioned previously, with sports science and health, we can master in physiotherapy. Well, what is the difference between physiotherapy and athletic therapy and training? Physical therapy, or physiotherapy, is a general program which includes non-muscular skeletal and musculoskeletal illnesses such as respiratory illness, burns, neural damage, cardiac disease, and strokes. Generally, physiotherapists will be more guided towards the medical field than the elite athlete side of things, where athletic therapy and training has complete focus on the prevention, assessment, treatment, and rehabilitation of musculoskeletal injuries. So be far more hands-on on the field. And that's actually something that ATT gets to do as part of their course. There's a lot of clinics and on-field experience, which we'll go through in a moment. So if we take a look at the course structure, as you might be able to tell, it is more specific, as I mentioned earlier, than sports science and health. So there's less modules and more of a emphasis on the modules that you're doing. So the theme of things, anatomy and injury management, are some of the most prevalent modules in the course. Training, rehabilitation, and prevention, biomechanics, physiology, psychology and motor control, professional preparation, and research. There is some overlap between ATT and sports science and health. There are some modules in which we take together, and there are some modules in which ATT might do in second year and sports science and health might do in third year. So there is some overlap, which is also just good from friends and socializing and networking component. With that crossover and being able to have a bit of back and forth and having some relationships with other courses. So taking a look at semester one, again, first year has a large emphasis on anatomy, but they also ATT gets a head start with anatomy and strength conditioning before sports science. We are combined for physics, for science and health, and we're combined for physiology. In second semester, we also share physiology and motor control and learning, and ATT get an introduction to athletic therapy and training. Okay. In second year, ATT will be working on clinics. So it will be a student-led clinic. Student-led clinics are led by the third years, and the second years will follow along and learn so that they can do the same when they move into third year to help the second years coming up. And in fourth year, actually, ATT have a placement. ATT has a placement, I believe, in third year as well, but they have a large placement in which they can go abroad. So if that's something that you're looking for, is to study abroad and develop those new skills through some large colleges, which we'll take a look at now in a moment. ATT might be for you. So ATT clinical experience, exposure to patients in years 2 and 3, 4 to 6 month clinical placement in fourth year, and that could include Ireland, the UK, USA, or Australia. So here we can see some of the Irish sites. Okay, from Shamrock Rovers, Bohemian, FAI. Like there's a lot of opportunities just in Ireland alone. If going abroad maybe isn't for you. And there we can see Dublin and Kildare, Ulster Rugby, Leinster Rugby, Athletics Ireland, Tennis Ireland, Swim Ireland. Okay, Sports Physio Ireland. So even depending on your sport, there's pretty much anything there for you. Okay, so it does have a high emphasis on the team side of things, but if more individual therapy is something that you're looking for, there is still that. Okay. And then life-changing medicine, UPMC. And then here, taking a look at British sites, large clubs like Liverpool, Manchester City, Southampton, London Irish, Sale Sharks. Like there is a lot of opportunities here also in England and the UK in general. And then in the US, I actually have a friend of mine who is going to the University of Pittsburgh next year. So it's very viable and very possible. It's not as much, it's just an idea. Like these are opportunities that are given to DCU students participating in ATT. As you can see, they're large universities in the US. And then here with Australian sites too. Okay. So speaking about how ATT are assessed. So again, similar to SSH or Sports Science and Health, it's continuous assessments, it's written assessments, and it's group projects. There's oral and written exams. There's final end of term examinations, oral and written, shadowing, clinic group work, supervised practice, 4 to 6 months clinical experience in year 4, as we were just speaking about. And then, of course, there is the final year project. So again, with ATT, it does have a large overlap in some subjects with SSH, but you do get that if you're looking to go into physiotherapy or just therapy in general for athletes or for the general population, it does have a large benefit to do athletic therapy and training if that is something you're interested in, over SSH, where SSH might have a more of a general scope. And if you're not too sure about what maybe you want to do, SSH might be a better suit because it does have so many options. So let's go over those career options with ATT. As I was saying earlier, there's the private practice, sports and injury clinics. These can be in general gyms, your own practice, or in, well, most sports environments now have private practices associated or bring in athletic therapists to treat their athletes. National governing bodies of sport, sports teams across all sports, from GAA, football, hockey, for their study. So if the academic side is more something you're interested in, and that might be something that you figure out throughout your studies, then of course you can still do so with athletic therapy and training. Athletic therapy therapists who focus more on the studying side of things also work alongside biomechanists to try and determine what are the best methods to prevent injury and to further treat injury. Teaching, so if that's another road you'd like to go down in the future. Working abroad, as we've covered, with the UK, Ireland, Australia, the US all being options. See it there, USA, UK. Okay. And of course, there's the new option of an MSc at year 5 in athletic therapy and strength and conditioning. As athletic therapy does finish with more of a strength and conditioning component in 4th year, this is a great way just to transition more into that if that's something you're looking for, if that's something you're passionate about, particularly on the team sports side of things, if there's massive opportunities there to make that a career. Okay, guys, so that's everything on ATT and SSH that I have. So if you have any questions, I'm going to come back now. I'm going to stop sharing my screen and we can go through any questions that you might have. No, as far as I know, you don't need physics and chemistry. You do need to have a science subject in either, I believe it's just one, and it has to be, I believe it's biology. Yeah. So how can you qualify as a physiotherapist? So you can do a master's to qualify as a physiotherapist. Again, it's a little bit dependent on what setting you want to work in. So if you want to be more in the medical setting, physiotherapy will be more, might be more what you're looking for. So yeah, it depends if you want to work with athletes or general population. Yes, I believe it's one additional year. No problem. And yeah, you might end up in an area where you don't expect. Like myself, I began the course as a mature student and didn't expect to have such an interest in genetics. I was thinking just more on the coaching side of things. And again, just by having such an array of modules, it can seem daunting at first, but you might find certain lecturers or lectures in general that just speak to you. And as you're going through the course, you realize that, oh, I want to explore this further. And yeah, that might even just shock you on what that particular module is. So whether it's athletic therapy or SSH, they both do offer a large array of options. And as I was saying earlier, the opportunity in both courses to go abroad. A close friend of mine who's doing his PhD at the moment traveled to Washington, D.C., to do his placement. And that, don't believe that was even on the intra portal. I believe he sorted that out himself. But that's led to a lot of opportunities for him now. And he was in SSH. So intra and placement in general can be a complete mind changer. And yeah. Any other questions, guys? And also, when it comes to the physics and chemistry in first semester, they're not things I did in school either. So you don't necessarily need to have physics and chemistry, one science is whatever that science is, if it's biology. The lecturers do make it that they want you to pass, and if you study, you will pass. Um, Obviously, I can't guarantee that for everybody, but that's I don't believe there was anyone who didn't pass in in my course, and it's I think it's quite rare that I actually was a class rep one of the years, and it was quite rare that someone didn't pass first semester. So I wouldn't worry too much about it. Just go in, get it done, and you might even enjoy it. Okay, well, hope that was of use and helped. So let's have thank you, Sonia. Have a lovely rest of your week, and thank you for joining in.